So, Dr. Perez, as you know, youth sports are going to be continuing in Lake County again in the fall and in the summertime. Start of baseball season and softball season for our young athletes. So, as a sports medicine physician, what are some of the main injuries you see with overhead throwing athletes that come into your clinic?
Well, it depends on the kind of overhead athlete is. So for me, overhead athlete is not just pitchers, baseball players, softball players. For me, overhead athlete is anything that the mechanics of the sports have a lot of, this kind of movement. Therefore, overhead. Swimmers, to me, are overhead athletes. Um, Swimmers, volleyball players, their repetition in their sports is a lot of overhead. So in my practice, I see. Let's talk about females, for example. I see a lot of teenage females with that they're very skinny. And then they play multiple overhead sports, volleyball and swimming, maybe softball. The problem that this patient population have is because of their being females and they're being skinny, they have a lot of laxity, meaning their joints are more elastic, more loose. When you have a double jointed type of patient, you tend to put a little bit more stress on the structures because if the shoulder is a ball joint, it needs to glide efficiently in the socket. And when you have a loose joint, it kind of moves, a little bit different. Okay, so those patients that I see complain of usually both shoulders hurt. They hurt with activity. Sometimes it start hurting with, everyday routine stuff. And you do an MRI and you don't find anything. There's no tear. There's, completely negative MRI. Those are a little bit harder patient to treat because the easier patient is the one that has a tear. You can fix it. Now, this patient, there's no surgical management that you can do, at least initially, to make them better. That's when physical therapy and a different spectrum of exercises can help them to strengthen the muscles around the joint just to contain that joint. Okay? And that's exercises that deal with a lot of posture, exercises that deal a lot of core, because core is related to the posture, and also the rotator cuff strengthening. Okay, because the rotator cuff are the muscles around the shoulder joint that helps with that dynamic stabilization. So those patients need to go through 1, 2, sometimes 3 regimens of physical therapy in order to get them back on track. Yeah, you can do some type of injections at some point, but the goal here is to improve posture, improve mechanics on how the shoulder moves. And that's a very specific group of patients that I see in my office. The other spectrum is the young kid, 13-year-old pitcher, okay, that comes with a shoulder injury, shoulder hurts. These patients are still on the growth. Their bones are growing, their muscles are growing, and if you put that type of patient to a lot of pitches throughout the year, they're gonna start hurting. They can hurt through the growth plate, okay, because their growth plates are still open, or they can have overuse injury to structures such as the labrum, which is one of the most important structures on the shoulder. Those are the two biggest group of patients that I see in my practice. Then you have the older, weekend warrior that tweak their shoulder, and those patients typically is because of overuse, aging of the joint. Those typically respond well to a regimen of physical therapy injections, like I've said before.